Hey, it's Dr. Brandon Pettke with Curis Functional Health. We want to give you 3 different things today that you can do on your own at home in case you're suffering with low back pain, or maybe even have some sciatica type symptoms, which is the pain going in the legs. So let's cover those 3 things. Miss Heather is going to help me out and demonstrate so you can see exactly what you need to do. But the very first thing I want to cover is anytime somebody has a flare-up of pain, no matter what's causing the pain, the root issue is inflammation. Inflammation is what is causing the pain. So I want you to think about if an athlete gets injured, what do? They never put heat on it, right? They use ice. Okay, so the very first thing you want to do if you're hurting is you want to use an ice pack on the area. So if we're talking about the low back, obviously you want to place it right across the low back. Even if you have symptoms going down, it's originating from here. So if you have them going down, still use the ice pack in that area. Okay, we have these moldable, bendable ones, but if you don't have something like that, then you can use a Ziploc bag, like a gallon Ziploc bag. Fill it up about a fourth of the way, and then fill that up just a little bit more with ice so that it starts to float, and that'll be a pretty good, and you maybe want to double bag it so it doesn't leak, but that'll be a pretty good ice pack that you can use. So 20 minutes on, 40 minutes off, 20 minutes on, 40 minutes off. Just repeat that as much as possible to drive down that inflammation. So that's the first and foremost thing. The second thing, that's where Miss Heather comes in to play. So we're going to use this chair. And so I'm going to show you some key stretches. There's going to be 4 different stretches that we are going to do. So the first one is going to be, it's called the piriformis. It's a muscle deep down in the buttocks. So she is going to cross her leg like that, okay? And then what she's going to do is she's going to take, she's going to actually lean towards that ankle, okay? So this is to stretch the right side. Now, one thing a lot of people do is they will hunch your back. So they kind of hunch their back like that. Don't hunch your back. You won't get as good of a stretch over here in this piriformis muscle. So she's going to keep her back straight, and she's going to bend at the hips and lean forward, taking your chest kind of towards the direction of that ankle. And so what you're going to do is you're going to hold that for 30 minutes, or not 30 minutes, 30 seconds, and you're going to do the next side. You're going to do it for 30 seconds, 30 seconds, 30 seconds, 30 seconds, 30 seconds. So 3 times on each side for 30 seconds. So it'll take you 3 minutes to do that total. All right. The next one's going to be similar. All right. So it's going to stretch the gluteus maximus. You may have heard that term before. So she's going to cross her leg, and then this knee she is going to bring up towards that chest. Okay. She's going to keep her back straight. Again, you're not hunching over, bringing it up. You're keeping the back straight and bringing it. It'll give a stronger stretch in the muscle. Okay. Same thing. 30 seconds. Then you would switch over to the other side. Hold that for 30 seconds. Do it 3 times on each side for 30 seconds, okay? The next one, and notice that she's up on the front of the chair on all of these, so you don't want to be sitting back in the chair whenever you do this. The next one, definitely, you want to be sitting up at the front of the chair. We're going to stretch out the hamstring, okay? So same thing again, keep your toes not pointed. It's not really, it's just kind of in a neutral position. And what you're going to do is not hunch down at the low back trying to reach it like the old athletics, okay? You're going to keep the arch in your low back. She's going to lean forward at the waist, and she's going to feel it stretch in that hamstring, all right? So it's the back side of that leg. Again, you're going to hold it for 30 seconds, and then you're going to switch over, and you're going to do the other side, and you're going to do each side 3 sets of 30 seconds per side, okay? And then the last one, we're going to actually come over here to the wall. So we're going to stretch out the gastroc, which is one of the major calf muscles. So she's going to put her foot, here, let me get this chair out of the way. She's going to put 1 foot forward, and then this foot she's going to put back. The heel is going to be on the ground, so you don't want to have the heel coming up off the ground. You keep that heel, and then she's going to shift her body forward. So she's going to bend that front knee while keeping this heel down on the ground. And what that's doing is that's stretching the gastroc muscle there. So she's going to hold it for 30 seconds, and then you can probably guess the theme that we have. She's going to switch it up, 30 seconds, do each side 3 times a piece, okay? So those are 4 stretches that you can do that will help your low back. So you can use the ice. Second step is the 4 stretches, and then we're going to show you some additional stuff. So we're going to come over here. Let me get these chairs out of the way. And I'm going to show you 2 renditions that you can also do for like a deep tissue massage. Put that to the side. So she's going to demonstrate. It's called a foam roller. Some people have a foam roller at home. Some people don't. So if you have one, then you can utilize this. It'll get a decent massage or deep tissue work. So she's going to bend one knee up. She's going to kind of be at a 45-degree angle, so you're not laying flat on it with both butt cheeks. She's gonna lay at an angle, and then she's gonna roll exactly like she's doing back and forth across the muscles. So that's gonna create that deep tissue massage on those muscles. All right, and then of course to do the, and you only have to do this for 2 or 3 minutes. It won't take that long. Then she would switch over to the other side, and then of course if she was doing the right glute, same thing. She would bend up the left knee, keep that one straight, and then roll back and forth across like that. Depending on your pain level, this next thing we're going to show you may or may not be able to do, because this one's going to be a little bit deeper. We'll put this one over here. So now we're going to use, I'm going to show you this little, it's called Lacrosse Ball. They bounce, all right? So the rubber they give, golf ball is probably too hard, a baseball is probably too hard, a tennis ball or maybe a racket ball, or ideally a lacrosse ball is going to be your best bet. So there's 2 different ways that I'm going to show you. One is a fairly deep stretch. Yeah, you can use it here. Let me move this out of the way so the camera can see. So you're going to keep the leg straight, and you're going to basically put it right on the muscle. At first, you're not going to move, okay? So at first, you just want to sit there on it for about 30 seconds or so. And what that's going to do is the muscle's going to start to give way and relax, all right? And then after you've been on for about 30 seconds or so, then she's going to just barely move, just a little bit. It doesn't take much movement, but she's basically working out that muscle, okay? And again, you're only going to do this for about another 45 seconds, a minute or so to release that. And then what she's going to do is she's just going to roll it just a little bit to a different area, and you're going to repeat that same process. You're just going to sit there for about 30 seconds, let it calm down, the muscle relax a little bit, and then you're going to roll on it for about another 45 seconds, minute, something like that. And you can usually do 3 or 4 spots in that general area. You don't have to know the muscles, but that will help out quite a bit. If you want to take it to a whole nother level, which a lot of times if people are really hurting, they won't be able to do this, but the next one is she's going to actually cross her leg over this. Sorry. You're going to bend this leg up, cross it here like you're crossing your leg, and you're going to it puts a lot more pressure on that glute and on those piriformis. Same thing, 30 seconds rest, and then roll around for about 30-45 seconds on the muscles. All right, so that, and you can do that on both sides, of course, just like when we did the foam roller as well. All right, that one's pretty deep.
Yes.
So those are 3 things that you can do on your own to relieve yourself of low back pain, sciatica type symptoms. Hopefully those help you out. If it's continuing to bother you for more than 3 to 5 days and those type of things don't take care of it, then I'd highly suggest you reach out to our office. We'll get you in, we'll go through a full evaluation, get you taken care of with some additional things in the clinic. So anyway, hopefully it was useful. Have a wonderful day. Take care.